everybody, and I'm Dr. Apoor Mehra, and I welcome all of you to the Sports Injury Course Part 2, Day 1 of the Shoulder Course. The course chairperson is Professor V.B. Bhasin, and the co-chairperson is Dr. Harpreet Singh. The other senior faculties in the course are Dr. Shekhar Srivastav and Dr. Raju Iswaran. So we'll have 4 speakers over 2 days. I have a small presentation to take you through what we have next. So I wrote these lines in the morning for Sir. There are a lot of surgeons who will teach you, but the teaching will choose few surgeons. We call it Saraswati Maa Ka Ashirwad. And Professor Bhasin is an extremely competent surgeon and somebody who will keep thinking. And when you talk to him, he will develop a thought process in you. Sir is a fantastic surgeon, a fantastic human being. Excellent. The sports injury course, the faculties, they are the people who are dealing with these injuries and their management day in, day out for many years. And what I want is that keep your mics on mute. This is a treasure to watch and hear. Utilize it to the best possible way. I can assure you, for each talk, our teachers have really worked hard. Today, we will have 3 talks. Fantastic start by Professor Bhasin on impingement syndrome. Shoulder instability by Dr. Shekhar Srivastav. And then, much loved Dr. Raju Iswaran will conclude the day with adhesive capsulitis. Few more things that they are with you this month. Tuesdays, 5 p.m. Listen to Professor Shantaram sir. And I would also like to thank sir and everybody for the phenomenal response to this series of lectures. On 20th June, Sunday, we have an MCQ session by Professor Bhupa Kumar sir. Dr. Dimri is really working hard for that, supported by Dr. Fahim. The spine course is being developed for all of you. Professor S.N. Tuli and Professor Sudhir Kumar sir will be heading that course. And I can assure you, you will be listening to one of the best surgeons. And on 27 June, you will have the MCQ session of the sports injury course. I will request, please check that your systems are on mute because a slight noise will disturb a lot of students. I once again welcome all of you to this session. I will request Professor Sudhir Kumar sir to welcome the students and the faculties to the course. Professor Sudhir Kumar sir.
It's indeed a great pleasure to welcome the speakers which consists of very elite faculty, and you are already aware about these faculty who had taken the sports injury, knee injury course earlier in 2 weeks, earlier week for 2 days, which was an excellent delivery. I also welcome the students who have been very keen to get this deliberations and the wisdom from the elite faculty. And you know that the problems in the shoulder have been recognized for a very long time. But in fact, in our country, the shoulder problems, solutions have taken a great leap with the younger orthopedic surgeons, with the advent of arthroscopy, and the great interest which has been shown by this faculty. With these words, I welcome you all again, and I'm sure you are going to have a great feast of this subject, which is of great importance in day-to-day practice in the outdoor, as well as in orthopedics, surgical avenues. Thank you very much. And I pass on the baton to Dr. Apoor for further deliberations.
Thank you very much, sir. And now I'll request, as I've always mentioned, my favorite teacher of conceptual orthopedics, Professor Anil Dhal, sir. His sessions every Monday are just class apart. And I wish all of you can listen to it again and again. My suggestion is all these talks, listen to them again and again. Each time you listen to it, you will find something more. And if there is a line that each teacher is 100 books, and if I have to substitute it with 101 books, Professor Dhal is the man for it. Sir, please welcome the students and the faculty in the course. Professor Anil Dhal, sir.
Thank you, Dr. Apoor, for the kind words. I do not know whether I am worthy of all this praise that you have bestowed on me. Nevertheless, I would not take much time, but I would definitely welcome the 185 odd students who are present in this Zoom meeting. And I am sure they are in for a great academic feast today as well as tomorrow. And I wish them that they are able to imbibe knowledge to the best of their ability and they benefit from it. Thank you very much. Over to Dr. Apoor for further deliberations.
Thank you very much, sir. And I just want to tell all the students here, in this session, we have Professor Shantaram Shetty, sir, Professor Gopakumar, sir. We have Dr. Shekhar Srivastava, sir, Dr. Raju Ishwaran, sir. We will, during the day, have inputs from them. I will request Dr. Harpreet to take over from here and welcome Professor Bhasin, sir, and then start with the lectures. Over to you, Dr. Harpreet. Thank you very much.
And I have fine-tuned my injection skills by injecting contrast in an MRI center. So the Hindi-speaking people will know this proverb, "Doodh ka doodh aur pani ka pani." if you have given the contrast outside the joint, you would immediately know all the gadolinium is lying outside the joint. So you can fine tune your trajectory by injecting gadolinium. Blind in most of these MRI centers, you don't have any guidance to inject the gadolinium, and you can fine tune your injection skills in this simple manner. With practice, you can very easily get that haptic feedback when the needle penetrates the capsule. And immediately after the needle penetrates the capsule, you are likely to encounter the humeral head, and the needle will strike the humeral head as well. So these two feelings will become a part of your haptic memory when you inject more and more frequently.
Okay, the thing is that you should not do the rotations. So best is to gently push and take it into flexion first. Okay, posterior capsular stretching which occur, take it back into extension, take it in flexion, adduction. It also stretches the posterior capsule, and in abduction. The trick is not to do the rotations. You may, after, if you have got full range in flexion and abduction, adduction, attempt a gentle rotation, but the rotation is the one which causes the fracture of the humerus. So avoid rotations. Otherwise, you do flexion, extension, abduction, and adduction.
Yes. So the acronym which was given was FEAR. You start with flexion, as sir said, flexion, extension, then do abduction and adduction and abduction, and last is the rotation. So because rotations is the one which can cause the most dreaded complication of your iatrogenic fractures. Yes. And always use a short lever arm, as just demonstrated. Hold the shoulder very close, hold the arm close to the shoulder.
Yes.
So don't use a long lever arm. And there is a concept of Codman's paradox, as Dr. Sheenam just wrote it down, that we can use that Codman's paradox, which is if we do forward flexion and then bring the arm in abduction and adduction, you get your rotation just like that without doing any rotations. So you can just do forward flexion and then bring the arm in abduction down, and then do abduction and then bring the arm down in flexion and extension. So by that paradox, you get your rotations without using any rotation. So that you can use, but most important thing is use a short lever arm. Hold the shoulder arm very, very close to the shoulder. That is the main thing when you're doing a manipulation and anesthesia.
Conceptual Orthopedics. The learning never ends.